Good evening, everyone, and welcome to tonight's webinar on navigating the healthcare maze with your healthcare team. My name is Ann Lee, and I'm the Senior Specialist for Programs and Online Education here at CanDo Multiple Sclerosis, and I'm excited to be your moderator this evening. Most of you are probably already familiar with who we are, but in case you're not, CanDo MS is a provider of lifestyle empowerment programs for people living with MS and their support partners. And through our programs, such as this webinar tonight, we help to empower people to manage their disease and move beyond their MS by adopting healthy and active lifestyle behaviors. And you can learn about all of these programs by going to our website. The web address is at the bottom of that screen there. It's www.mscando.org/programs. And you can learn about all of our programs. We have our 4-day CanDo in-person program that we do once a year. We have our 1-day Jumpstart program that we do about 6 times a year around different cities in the country. And we have our 2.5-day Take Charge program. And of course, you can learn about our upcoming webinar programs as well for the remainder of the year. So please remember to visit our website and register for any programs or webinars that are coming to your area. You can also connect with us on social media. We have a Facebook page where you can like us and find all kinds of information regarding our upcoming events and programs. You can also connect with us on Twitter to receive the most up-to-date tweets about what's happening with CanDo MS. And you can also find our channel on YouTube, and you can browse all of our fun recordings and archived webinars that we have for you to view. We're also on LinkedIn and Pinterest, so you can also find all of our social media links on our website as well. And just a few housekeeping items before we get started. We will save about 10 to 15 minutes at the end of the webinar for questions and answers. If you do have a question, you can please post them in the chat feature that's located on the left bottom corner of your computer screen. So to submit a question, just type in that small box that says Chat with Presenters and click Send. This presentation is being recorded and will be archived on our website. So because this is being recorded, all of your phone lines have been muted. And I'd like to now introduce our presenters for this evening's webinar. On the screen here you'll see Dr. David Rintell. And Dr. David Rintell is a psychologist who's been working with people with multiple sclerosis and their families for over 25 years. He is on the staff of the Partners MS Center at the Brigham and Women's Hospital in Boston and the Partners Pediatric MS Center at Massachusetts General Hospital in Boston. He is a clinical instructor in psychiatry at Harvard Medical School and is also on the faculty of the Brandeis University Genetic Counseling Program. And next we also have Ms. Lynn Stazzone. Lynn Stazzone received her RN bachelor's degree from Ohio State and completed her master's degree in neurological rehabilitation as a clinical nurse specialist at Boston University. After completing her postmaster's certificate to practice as a nurse practitioner at Massachusetts General Hospital, she began her career at Partners MS Center in Boston, affiliated with Brigham and Women's Hospital. With over 30 years of experience, Lynn utilizes a holistic approach when treating patients with MS, focusing not only on modifying the disease with currently available medications, but also a strong emphasis on symptomatic management. Lynn has published literature in a number of journals and has contributed to a recent textbook on MS. She's a nationally recognized speaker at patient programs and offers professional continuing education on topics including the therapeutic management of MS, improving adherence to disease-modifying medication, symptom management, and promoting resilience to MS patients. So we're very excited to have David and Lynn, and I'd like to now welcome you to the program.
Well, hi, this is David Rintell. Lynn and I are sitting together in an office in Boston, Massachusetts at Partners MS Center, which is part of the Brigham and Women's Hospital. And we're just delighted to be with you tonight and to be talking about this really important topic. And we hope that you will both enjoy the webinar and learn a lot. And I'm doing the introductions, and Lynn is going to start talking in a moment. So let me just say that Lynn and I have worked with each other for a long time. Our offices are next door to each other, so we know firsthand about the collaboration that can exist between healthcare providers in MS, and I think that our collaboration has been really productive. We're going to start out with a little bit of a poll, just so we know as a community tonight who's on the call. So please, if you don't mind, telling us your relationship to MS, whether you're a person living with MS, a support partner, a healthcare professional, or other. Okay, so please check that off, and then I think we'll be able to see the results right on the screen. Here they come. Just give a moment for that. Yeah, and if the people who checked off other wouldn't mind putting in the chat what their relationship to MS is, we'd be really interested in hearing about that, okay? But clearly, almost 95% of people are on this webinar are people living with MS, and there are some support partners as well. So we welcome you, and we're interested in hearing about the 5% who are other, or some people are changing their minds. Anyway, we'll move on as we go along. So now we're just interested in finding out how old you are. So please check off the age range you see there. I don't think I need to read it. Okay? Wow, you all are very good, very fast. We have a pretty wide age range here. So it seems like the largest group on the call are 51 to 60, although some of you are changing your mind about your age as we proceed. But I'm really joking. I think that as people check in, then it changes the percentages. I see one of the people who checked off other is a person living with MS who's also a self-help group leader in California, where you're very welcome at this webinar. And another person was misdiagnosed with MS, but now is still a co-leader in her area's MS support group. Also great that you're staying with us. And how long have you been diagnosed with MS? This should, whether or not, you could put in how long you believe you've been living with MS or since you received the actual diagnosis, just to get a sense of who's on the call. Just wait a moment as people check in. So we have a really pretty wide range. And, you know, a lot of people who are in their first 5 years, but many other people who've been living with MS for a long time, and a pretty good percentage of people who are living with MS for over 20 years. So,
and also people who have various experiences with the healthcare system in general,
yeah,
which is good.
So we hope you will use the chat to let us know what you're thinking and put in your questions. And we very much hope that this is, although it's very difficult not to do a lecture on a webinar, but we hope that there'll be plenty of questions that we could address and talk over together as we proceed. So, Lynn.
So basically, I'm going to start off by saying sometimes it's hard to get along just with yourself. I mean, you have good days and bad days with yourself and how you feel about yourself, but then when you have to mix that with somebody else and try to communicate what you're thinking on a daily basis and what someone else is thinking or how they're receiving what you're saying. So what we're trying to say is communication is key to everything, not just living well with MS, but living well in general. Then when you put MS in the mix, it's so important to have that information flow accurately. We want to have the system flow really well, so you have to communicate only with yourself and how you feel about certain things, but also with your healthcare provider. So what does that mean? I mean, you have to communicate effectively with your healthcare team, your healthcare provider. And that doesn't mean just your physician, your NP, or your PA, but your whole healthcare team. And that could be your social worker, your psychologist, your PT, your OT. And if you don't communicate well with them and tell them how you're feeling, they can't provide the best resources for you or the best solutions for you. So it's a two-way street. In order to live and stay healthy, you have to communicate really well, as well as expect good communication from your provider. And if you don't do that, your health is going to be poor. If you don't have that good two-way street, your health is not going to be as well as it can be.
So Lynn, just to make sure everyone knows what the letters NP and PA stand for, can I ask you just to?
Absolutely. So when you see a healthcare provider, you know what an MD is. Maybe you don't know what a DO is, but an NP is a nurse practitioner and a PA is a physician assistant, who you might see in your travels through your MS experience.
Now you better say who a DO is.
A DO is a doctor of osteopathy, so they're educated in a different way. They actually don't follow the MD model, so they actually look at more of a holistic approach in some ways. So they are trained like an MD, but they look at the whole person a little more than an MD does.
MS is a very complicated and complex neurological disease, and it changes over time. There are a lot of unanswered questions still, even among the top MS researchers and MS scholars. But one thing that's both something great, but that's added to the complexity, is that we now have a number of different treatment options available for MS. When Lynn and I started in this field, there were very few options for patients, and in the words of our colleague Roz Kalb, when you went to see your healthcare provider for MS, it was diagnose and adios, because there were really not much to offer in those days. But now, because of the choices of treatment, it's actually made it more complicated from the patient and family member's point of view. And let me say, we're going to use healthcare provider to mean your neurologist, your nurse practitioner, your physician's assistant, or other healthcare providers that you see. We're trying to be as inclusive as possible here to match the inclusiveness of healthcare and MS. So as Lynn has already said, communication goes both ways. And your relationship with your healthcare provider in MS is a long-term relationship. Just like in other long-term relationships, it's crucially important that you develop a positive working relationship with your healthcare provider. So this involves a lot of things, like learning how to communicate important information about your life with MS, and also learning when it's time to stop reporting and to start listening to your healthcare provider and find out what she or he has to say. It's usually the case that time is limited when you have a meeting with a healthcare provider, so it's important to use your time wisely. And we'll talk more about this later on. Now, it's not only the healthcare provider who determines how your visit's going to go, it's also you, the patient. And we as patients, because we all are patients of the healthcare providers, are also patients on certain days. We determine what happens in a meeting with a healthcare provider. The agenda is not completely set by the provider.
So you have to remember that you are the expert in you. You are the expert in MS. Now, maybe you're newly diagnosed, so maybe you're not what someone would call an expert, but most people are going to go on the internet. You're going to know what your symptoms are. You're going to know what you are, how you feel. So you need to not let that healthcare provider guide that interview. You need to express how you feel, how you think, because that is a part of that communication process.
Yes. A meeting with your healthcare provider is a meeting of experts. Your healthcare provider hopefully has vast knowledge about MS, and you have vast knowledge about your own health and your life situation.
So getting ready for your visit, this is really important, because this is like preparing for, let's say you're going to a tax provider. You want to bring all that information about your taxes, because they can help you better to get certain refunds back on your taxes. So you need to go to your healthcare provider with a visit of all the things that you're prepared for. So that might be, you want to come with a list of medications you're on. Okay, let's say you're newly diagnosed or you've had the disease for a long time. you might be on other meds for other reasons. So you need to come with a list of those medications. Very important if maybe you're coming to one center but you've had your primary care at another center, you need to come with all those records because we need to take all that information together to come up with a plan for you. You also need to want to come with a list of what you want to accomplish for that visit. And that could mean whether you don't have a diagnosis or you've had the diagnosis from what we've seen at the pool for many, many years, you still have certain goals that you might want to achieve, and that's where you want to bring that with you. Also, bring a list of questions. What do you think you want from that? Maybe, I don't know what I have. Can you help me diagnose this? Or I've had the disease for 20 years. What do you want to accomplish from that visit? Also, it'd be really important to bring someone with you. Bring a loved one or a friend, a spouse, a care provider oftentimes comes with people, just to have them be that backup. Also, doing that, you need to set ground rules with that person. When you want them to talk, when you don't want them to talk. And also, come to that visit with something to do while you're waiting, because in many office visits, you might sit there way beyond your time of an appointment. So be prepared to do that and be calm and be relaxed. Bring something to do while you're there. And we'll be more specific about these points as we proceed.
So you already know how to do this because you prepare for certain meetings and events already. You may prepare for a meeting with your boss, or you might prepare for when your friends are coming over for dinner or for a trip in particular. A lot of people really try to work out the details of the trip so they're not surprised. And it's that same kind of preparation that we're advocating that you do before meeting with a healthcare provider. You want to have everything you need with you. So if you're traveling, you want your passport and your ticket. And if you're seeing your healthcare provider, you want the important information with you, and as we'll talk about in a moment, and the important questions and points that you want to make during that visit.
Okay, so here's the meat of the matter. We are going to propose that there are 10 steps to make the most of your visit. And this is our thoughts, and we certainly will hope for comments on this and questions afterwards. But here's our thoughts on this.
Before we do so, we thought as a community it would be good to know how satisfied you're feeling now with your visits with your healthcare providers. We're talking about your healthcare providers for MS, so please let us know how things are going out there for the community of people who are listening tonight. Interesting how things are developing. It's good to see that there are a lot of people who are feeling satisfied with how their visits are going, but it's also a considerable group who are neutral or dissatisfied.
So we hope that this will help with that.
Yeah. We hope this webinar will help you know what to do if you're not feeling good about your visit, and what steps you might take to improve it or change if need be.
So one of our steps of the 10 steps is prepare yourself. Be calm, really what the slide says, and make a plan. So it's different. Every visit is different. Is this you have a symptom and they're referring you to an MS clinic to see if you have MS? Is this a routine follow-up? You're doing well or you're not doing well, but you've been in the game for a little bit. Are you having an attack? Is there something currently active going on that needs to be addressed more in an immediate fashion? Are you just meeting to review your meds? You've read something on the internet. You've talked to your neighbor. You've gone to a support group, and they said, I'm on such and such med. Why aren't you on that med? So you want to come and talk to your provider about different medications that you've heard about, and are you on the best medication? have your questions ready. And this is what we mean about preparing. Look at what you really want to gain from that visit. And think about what's been going on with you over the past few months. Generally, we ask people, we've seen you 6 months ago, how have you been doing? And really look at that time period, not how you were doing 10 years ago, but how have you been doing recently? And this is a question that you need to ask before you come in.
So most people who are living with MS see the healthcare provider they see for MS pretty infrequently. I mean, most people here see their provider around every 6 months, and that varies. And you might see your neurologist and nurse practitioner perhaps every 3 months, or some people, if they live far away from their provider, could see their provider much less frequently. So it's really worthwhile planning, and part of the planning is to talk over the visit with someone important in your life, your partner, a relative, a good friend. Talking it through can help you to clarify what your goals are for the visit. And your loved one can also remind you of how you've been doing with your MS during the past few months from their perspective. It's kind of a checks and balances. You might say, well, I think I've been doing pretty well. And they might say, well, compared to 6 months ago, there's really been a couple of changes that you should let your healthcare provider know about. Getting someone else's perspective can be really helpful.
So I think sometimes you live so well with the disease that you adapt so well. And it's good to bounce that off of someone else, like David said, because they might see it from a different perspective.
Yep. That's a good point, Lynn. So our point number 2 is, before your visit, make a list of all of your questions and everything you want to tell your healthcare provider about your experience with MS since the last visit. This is Susan's list. She's thought about 5 things which concern her. As you can see, urinary problems, fatigue, tingling in her leg. She's wondering if her medication is actually working and how her MRI is looking.
So I think you have this list, and then you need to, how do you reorder it? How do you prioritize? You have only a certain amount of time. Sometimes it's 15 minutes, sometimes it's a half an hour. Maybe some people have the luxury of an hour. So you need to decide what is your most important question and prioritize. And you go through this list, and maybe you'll end up having to set up another meeting to get to the other questions. And you just want to be able to do this so you get the answers that you need to get.
So you can see that Susan's list, now that it's in order of priority, shows that she feels like it's most important to hear about her MRI results, and she's moved that to the top of her questions. So if there's only one question answered, it'll be, what does her MRI look like? And if there are time for 2, it's to see whether or not her healthcare provider feels like her disease-modifying medication is actually doing the job. So she's moved them to the top of the list. We hope that all of your questions get answered, but we know from experience that sometimes a healthcare provider and a patient and a family member or a partner could spend a really long time on the initial questions. So make the initial questions the most important ones.
So number 3, to use the time wisely. So the message here is sort of don't get caught up in the small stuff. You have a limited amount of time. So I think in any relationship that you have with somebody over time, in any situation, your spouse, your healthcare provider, your florist, whoever, it's good to have a personal relationship. We say, how's your kids, or how was your skiing trip, or things like that. But that's going to take away time from the visit itself. So you really need to get that over quickly and really address the questions right at hand. So don't get hung up on the small stuff per se.
So I just want to give an example about using time. I have a patient, a man who sees me, and he always comes late. Now, some people run late. That happens, and I understand it. So and you know, a psychologist has more time to meet with a patient than most healthcare providers. So he might come 15 or 20 minutes late to the appointment, and then he wants to use the time during our appointment to talk about why he was late. First he talks about why it was hard to leave his house. And then he talks about the traffic that he encountered on his way into Boston. And I tell him, is this really the most important thing that you want to talk about now? Because let's talk about the reason why you're coming to see me. So I always think about this and about him when I think about using time, that he uses his time really not very wisely. It doesn't really matter to me why he's late. I think when he gets here, we should get down to work.
So I think sometimes pre-printing material for your healthcare provider so they have information before your visit is excellent idea. But I think it's oftentimes the healthcare provider also has limited amount of time. So you really have to still prioritize, come with that information even though you might have sent it to them, to have that before you and say, these are still my priority reasons why I'm here.
So when we see our healthcare provider, and this is true for a lot of people with MS, we want our provider to be pleased with us. And a lot of people, when the question is asked, how are you doing, the patients will say, I'm doing well. It's the socially acceptable question. We all want to do well, and we sometimes state how we want to be rather than how we really are. And let's face it, we don't want to talk about embarrassing things like sexual functioning, bladder problems, bowels. And especially, we may not want to say that we've been depressed. Because although, depression is a big problem, sometimes it feels like, well, gee, that, we shouldn't be depressed or we should be doing better. And let me underline this. It's hard to say to our healthcare provider that we're not taking our medication as prescribed. Of course, our provider has prescribed it, so we're saying, you gave me some instructions and I didn't follow them. Now, you may be taking supplements or some non-traditional treatments, and you don't tell your provider because you don't think your provider believes in that kind of thing or agrees with them. But let us make this point that it's really important that your provider knows what you're taking. Some supplements and natural remedies change the way your body metabolizes the prescribed medication, so it's really, really important and relevant information. And let me assure you, your healthcare provider has heard about all of these problems before, whether they be sexual functioning problems, that you're taking a non-traditional treatment, that you're not taking your medication as directed, and is really unlikely to be shocked by what she or he hears. So it's so important to be honest. It's hard to do, let's face it, but it's really important to be honest. And the best way and the quickest way to solve a problem is to identify it and to tell it like it is. Now, if you feel that there isn't sufficient trust between you and your healthcare provider, or your provider is not doing a good job of listening, I would say talk that over with your healthcare provider. If you can't really let your provider know what's happening with you, that's a relationship that needs to be repaired.
So once again, if you aren't open and honest with yourself, it's very hard to have this open and honest relationship with your healthcare provider. So you really need to look at yourself first before you set any expectations or goals with your healthcare provider. Sometimes we've certainly been in appointments where I'll ask a question and it's not the person who's there for the visit who provides the answer, it's the significant other or the person who comes with them and says, no, that's really not what's happening. So it's really important to really look at yourself and be open and honest with yourself before you expect that from any kind of relationship with your healthcare provider. So I think adherence is crucial because if you don't take the medications that have been prescribed, how will we know if it's of any benefit or not? And this is where it becomes crucial to be open and honest with your provider. And there's just a little grid up here that shows that for every 100 prescriptions that are written, only 50 to 70 go to a pharmacy. So we as providers might prescribe something, but almost half of them even go to the pharmacy. Less than that comes out of the pharmacy where the patient even picks it up. And then there are records by refill that pharmacies can track this that show that even less are taken properly, and then even less than that are refilled. So we know that it's just a way that people might say, oh yes, I'll do that, I'll take a prescription. Some of them actually make it to the pharmacy. Even less are taken. So how do we know as providers if you are taking something, if it's a benefit or not? So you might say I'm getting worse. So I'll say, let's change your disease-modifying therapy based on the fact that you're saying worse, but I don't know unless I ask, unless you tell me that you're not taking that particular medication. So this is where adherence is crucial, and having that open communication is so important. So why are some of the reasons that people don't take their medications? And the top reason actually is forgetting. And that's so natural. If you have to take something every day or twice a day, or you have to do an injection, you might say, oh my goodness, I forgot. I can't believe I did that. But that is the top reason for not taking the medication. It's not like people are purposely not doing it. Or it might be expectations, that you think if you take a particular medication that, let's say, my right leg weakness is going to get better, when in reality the medication that you've been prescribed is so that your disease doesn't get worse. So the expectation of a drug is my right leg weakness hasn't gotten better, so I might as well stop it because I haven't gotten worse, but I also haven't gotten better. Also, side effects. Certainly, as we get farther along in all the disease-modifying treatments, there are more and more side effects that can occur. And, if you have to inject every day, or you get nauseated, you have flu-like symptoms, you have flushing or nausea, vomiting, or diarrhea, those are hard to take. So the side effects can be overwhelming. Also, there is documentation that shows if you have a poor relationship with your provider, you're not going to adhere to your medication as well because you don't have that relationship with them. You don't tell them that you're taking something or not taking something. You don't tell them that you're having side effects, and they can't work with you because oftentimes with a lot of these side effects, there are medications or even simple things as eating food with a medication that could help those side effects be less. If you have a weaker support system, so if you don't have people that necessarily could maybe help you with injections or remind you to take your pills, that's harder to do. And we know in many relationships, if you have people behind you to support you, you're going to do better. Or you could just say, I'm just so tired of it. I don't want to be reminded every day that I have this disease. I don't want to have to take a pill. I don't want to have to do an injection. I'm done. I'm just don't want to do this anymore. Or depression. We know that in depression, you're not going to adhere as well to medications. And we actually are going to go into depression a little bit further on in this talk.
So Lynn, I feel like it's not fair unless I make my own admission that I've not always been adherent to the medication that I have to take for my chronic illness. And I've been taking it for many years, and it's only recently that I've been trying to take it as it's been directed, partially in the hopes of feeling better and functioning better. But if I had to say why I haven't been as adherent as possible, I think that strangely doing it my own way made me feel a little bit like as if I were in control.
Right.
But truthfully, I was in less control because the medication, I wasn't taking it at the right schedule, and I think the medication has been more helpful to me, taking it on schedule. So it was kind of an illusion of control, but we like to kind of feel like, we're in the driver's seat. And perhaps people like me might need to think that being in the driver's seat may mean following the speed limit more often than not, or driving safely rather than driving erratically or driving crazy by making our own alterations in how we take our medication. I think adherence is a really big problem in MS. that the percentage of people who are not taking their medication as directed is pretty high. And I think the evidence is that people would do much better if they are adherent. And when healthcare providers see someone who is not doing as well as expected, or whose MRI might not look as good as you would hope, then it's important for them to ask whether or not the medication really has been on track for the patient. And for patients and their families to know that you could really be putting your own future and your family's future at risk by not taking it as directed. We know what happens when people take the medication at the dosage that has been tested. But if you don't take it as directed, you're in a kind of gray area where we don't know whether or not it's effective at all. And I don't think anyone really wants to be there.
Right, and I think control is so relative. So you can think that you're doing something because I'm going to make a stand. I'm not going to do what they tell me to do. But in all actuality, control is really having that communication and expressing that to your provider that, I'm not going to do this because I feel out of control or whatever it is. But you are being more in control to have this open communication and discuss those issues.
So as Lynn pointed out, depression is one of the factors that reduces adherence. So it's really important for us to talk about this. It's really common in MS. At least half of people with MS will have a significant depression during their lifetime with MS. And when we're depressed, we're not able to use our abilities and our resources and strengths as well. And depression is very treatable and in MS, and most people who experience depression can be successfully treated. I say most, but my experience has been pretty much all. So just so we make sure that you know what depression is, the symptoms of depression are listed here. Let me just point out that a number of them overlap with other MS symptoms, like depression causes fatigue, and that's important to know, and trouble sleeping, which can cause fatigue. And the second one, irritability, sometimes it's hard to know if someone is depressed. You can't really just tell by looking at them, but family members know that if someone has become very irritable and grouchy, that they may be depressed. So that's one of the outward signs of depression. So treatment with depression can be found with antidepressant medication, with counseling by a mental health counselor, or it could be counseling from a person of the clergy, a minister, a rabbi, an imam, a priest. Exercise has been shown to be very helpful as an antidepressant, and helping other people is something that lifts your mood, and it lifts it right away. So even if you don't feel like you're generally depressed, if you're having a difficult day, if you think, well, who can I help today? And that could actually lift your spirits right away. And you might say, well, I'm having my own physical problems, I can't help anyone. And I'd say, well, gee, can you use the phone, or can someone help you use the phone? And I'm going to guess there's someone in your life who would feel better to hear from you on the telephone. And that's a way of helping someone right away.
So our fifth reason for having good communication in your healthcare journey is we sort of live in a world where we have expectations that if you have a headache, you take Tylenol and the headache goes away. You have diabetes and you check your blood sugar and you give yourself a certain amount of medicine, insulin, metformin, oral medication, and the blood sugar goes down. In this world, it takes time. So a medication might be prescribed, but you have to give it at least 6 months or so to know, is my disease going to be stable or not? So it takes time also as a newly diagnosed person to diagnose the disease. And then where does the treatment fit in? So you have to be a patient, in other words.
So some problems can be fixed, or fixed easily, or fixed quickly, but that doesn't mean that we shouldn't still be talking about them. So you may have a problem that your healthcare provider has tried to treat and it still is there, and I think it's really important to let your provider know, particularly if it's bothering you. And your provider may not have any answers for you, but at least he or she knows that that's still bothering you, and it helps your provider kind of think about that, or maybe read some of the research to see if there are something helpful, or at least just to know that that's how you're experiencing your MS. So as we've said, MS is a pretty complicated illness, and a lot of the concepts are pretty complex. And sometimes a healthcare provider gives a lot of complicated information all at the same time. And of course, the provider will say, do you understand? And there's only one answer to that question. We all say yes automatically. It's like, how do you feel? Fine. Do you understand? Yes. But we don't always understand. So ask questions. And if you don't understand, say, I don't understand. Sometimes bringing a partner or loved one to be a second ear can help you understand and remember what was said. We advocate using a tape recorder or someone to take notes during the meeting. And if you leave your appointment and you feel like you didn't really get it, set up a follow-up. So you can have another meeting to kind of go over that material.
So just always to reiterate what David was saying is to check out what you think you understand and always ask questions. Say, am I hearing what you said? Is that what you said? Always ask questions, because if you don't, you're not going to go through the process and understand what the provider is trying to explain.
Because the information is usually pretty complicated, some people request a copy of the note from their visit as a way to keep track of what happens in their appointments or to go over it. In some healthcare systems, you can actually access the notes online, but you can ask your provider. Now, not every healthcare provider is able to give a note. It's pretty time-consuming, or they may not have office staff to do it, but it is okay to ask. Lynn, what do you think about that?
So I think it's very difficult, from my perspective, to provide a note for a patient. I oftentimes don't dictate my note till hours after I see a patient. I would rather spend my time talking to a patient than writing a note at the time of the visit. I'd much prefer to have a further conversation. So I'd rather have someone call me and say, after our visit, I didn't understand what you were saying. I'm not that I'm opposed to providing a note, but I think there's something missing when you don't have that give and take relationship.
Thank you. Good to have different perspectives.
Absolutely. So the seventh discussion point here is discuss barriers. And I think it's really important. We're all different learners. We all receive and perceive information in different ways. Some people are very visual. They would like a pamphlet on information so they can see it, they can read it. Other people would rather go to the internet. Other people need a verbal conversation where that's how they perceive and understand information. And I think you need to discuss what you've read. You come to a visit. I've heard such and such on the internet, and we know there is just a barrage of information out there. Some of it could be true, and some of it could not be true at all. So you need to come with that information. I've heard such and such, and discuss that with your provider. Also, lifestyle changes are very hard to do. We expect people to stop smoking, to eat properly, to exercise. And we say this and communicate this, or take your disease-modifying agent as prescribed. But if you think that you cannot take, let's say, an oral medication twice a day, and you know you're not going to do that, or you know you can't inject yourself, it'd be better to say, I know I can't do that, than to say, yes, I'll do that, and not do it. So it's very important to say and be honest about what you think you can do, what you cannot do, and what you can change, and have that discussion and have it meaningful.
Just let me reiterate that sometimes your healthcare provider will say, I want you to take this medication. Sometimes it's an injectable or an IV. And, if you really feel like you can't do it, and now we have alternatives, then it's important to let your provider know, or even if it's to do any kind of medical procedure, any kind of medication, if you feel like that isn't something you can do, you might as well say so right from the beginning, rather than waiting for your next appointment to say, sorry, doc, I didn't do it.
Especially if the provider says, I think this would be the best choice for you, but if you can't do it, then it's not the best choice for you.
Mm-hmm.
So this is where you need to say that.
Yeah, really good point.
So our eighth point here is to follow up. So the same with taking medications or to come with questions is also if a provider suggests a certain appointment for you to go to, let's say an MRI, or to follow up with, let's say you're having some issues with ringing in your ear, and maybe it could be MS, maybe it couldn't, but we want you to go see an ear, nose, and throat specialist to rule out something else. It's very important to follow through on those appointments. So really, follow-up is just as crucial in this whole process.
So I don't mean to sound like a confessional, but I would say, well, sometimes it's been hard for me to follow up, particularly when my healthcare provider tells me to do something that I think is going to be really uncomfortable or yucky. So when I was first over 50, you have to have a colonoscopy, and I was first told to go for one. It took me like, I don't know, 9 or 10 months to make the appointment just because I felt like I couldn't face it. So don't be like me. I'm giving myself as a negative example. But just to acknowledge, sometimes, we don't want to go to another appointment. We want to just go back to our life. But if you don't follow up, there's a reason for it, and it could be really important. So.
But I think the same example, if we're talking personal and we're talking about colonoscopies, I talked to my primary care doctor and I said, I just can't do it. So let's work around that. So I think you have to be honest about what you're going to do or not do. So
our point number 8 is to develop 9. Sorry, good to have you here to point out that I get the numbers wrong. Is to really pay attention to the relationships with not only your healthcare provider, but their staff, their office staff. Again, this is a long-term relationship, and the relationship with the other folks in the office can be really important. I will say that the people who have established a relationship with office staffs are probably the most likely ones to get a quick appointment when they need one, because the office staff knows who you are, and they know that you're not just a complainer. They know there's a face connected to your name. And these relationships really become as important as the relationships that you have with family members and your partner.
So I think it's another way to take charge. Just like in any relationship, it takes years to develop. And there's going to be bumps in the road, and you're going to make mistakes, and the providers are going to make mistakes, and the healthcare center that you go to do are going to make mistakes. But not to judge too quickly, and to build that relationship, and to treat those that you are involved with as you would want people to treat you.
So I think Lynn has said this, and maybe others too, but something good to remember, that a few kind words is the best gift you can give your healthcare provider and her or his office staff. And that even though the occasion for a visit for your MS is probably not the best day of your week, to remember to express kindness to the people who are helping you can go such a long way to building good relationships.
So talking about building relationships, we're talking about building a healthcare team. And some people might be fortunate enough to go to a multidisciplinary MS clinic where you have all providers in one site, and other people might have to build their own multidisciplinary team. And it doesn't really matter which one you go to, but you want to be able to have this interaction between teams. If you don't go to a multidisciplinary clinic, you need to sort of be the keeper of the keys as far as bringing your records to one provider or another, requesting that each individual provider provide that information to each part of your collective team. And if you don't keep these records, even if you go to a multidisciplinary team, it can get rather confusing. So you, like I said, have to sort of be the keeper of the keys and really be that center spoke to your healthcare team.
So unfortunately, ours is not actually a true multidisciplinary clinic, but we do have a number of disciplines. And Lynn, who's a nurse practitioner, will often knock on my door, even when I'm meeting with another patient, because there's someone she thinks would benefit from talking to me. So I can step out for a moment and meet that person, and or there might be a specific question about healthcare that can be addressed right away. That is really the beauty of a multidisciplinary team. But that doesn't exist in every location, unfortunately.
So what do we really mean about a multidisciplinary team? So you look at, let's say, neurology, meaning the neurologist, who certainly is the person who would diagnose the MS. Nursing can be not only myself as a nurse practitioner, or I would put up there also a PA, a physician's assistant, but also there are many clinics that have clinical nurses who would be maybe the first person that you would talk to before you talk to your healthcare provider, who might relay this information to the MD, DO, PA, NP. Sorry for all these initials. Also part of this team could be a physical therapist or a PT or an occupational therapist or an OT. So you might go for gait training or how to use specific utensils as far as a OT or dexterity issues. Urology is a big component where we often send patients if they're having issues with bladder, such as urgency, frequency, hesitancy. Mental health, absolutely a key component, and you heard David talk about issues of depression. Neuropsychology would be to test if people are having issues with cognitive problems, such as short-term memory, word-finding difficulty, multitasking, and this is where it might come in handy if you have that jobs are being affected by this, or schoolwork. Speech therapy if there's problems with that. And primary care, I think, is key because oftentimes it's the primary care doctor who say that must be MS, and they blame everything on MS, where I think the primary care really needs to look at you as a whole person. It's not just your MS. You have other issues. You have other organs that are healthy or not healthy that need to be addressed. Also, maybe not on this list is a physiatrist who can look at issues such as spasticity or how you move about in your environment. So these are just some of the key players that is part of your healthcare team.
So when you're building your own team, you may be utilizing professionals who work in different institutions and who don't have access to each other's notes. So it's important to ask for your different providers to make contact with each other and to communicate with each other, and that kind of forms a team even if people are not centrally located. Now, the way that you can accomplish this is through a document called a release of information. Every medical provider has one which would cover, this is an example from one from Alaska. I don't know if there's anyone listening from Alaska, but it was just something available on the web, and Alaska seems very, very lovely to me. Anyway, so if, let's say, you're a neurologist or a healthcare provider for MS and you want that person to communicate with your physical therapist to make sure the two of them are working on the same goals or communicating, so you fill out what's called this release of information and authorizing your nurse practitioner or neurologist or someone to communicate with your physical therapist at Horizon Physical Therapy down the road. Okay, and everyone has a form like this and can help you through that. And once you have the release of information, there is no problem that is posed by HIPAA. And if you hear that, oh, I don't communicate with other people because of HIPAA, this is the release from the restraints of HIPAA that you have agreed to. So that solves that problem. Now, we think it's important, since you're the center of your multidisciplinary team, you're the most key team member, that's important for you to keep kind of your own records of your appointments. So you might, now I would not bring a huge 3-inch loose leaf binder full of papers, because your provider is just going to look at that and say, I can't read that whole thing here. But you may pull out from your own records what's really important. And your physical therapist, for example, might have a note saying, I think that Mr. or Mrs. Jones could benefit more from physical therapy if the fatigue was more addressed by the nurse practitioner or neurologist. So that might be the paper in your folder to say, oh, here, by the way, here's a note from my physical therapist.
So it's important to be realistic about this. There are some folks who are really good at writing everything down, and they hand this huge folder to the healthcare provider, and that's going to take up your whole visit, the healthcare provider shifting through all these notes. So I think, as David said, it's important to address what is important to you at that visit and maybe just pull out key points to that loose leaf binder. So number 10 is that really take charge. And this is our summary thing, is that, take an active role. This is you. This is your health, and you are you're the driver of the ship, the driver of the boat. It's up to you to see where it goes. And also keep in mind that it takes a long time to build good relationships. It's not something that's going to happen over time, and maybe your first visit with your provider isn't going to be the most warm and fuzziest, but at the next visit, you could say that to them. Develop this relationship, and don't cut it off too quickly. Be very open and honest, and expect the same from your provider. Ask questions. All the time ask questions, because there's no such thing as a stupid or a silly question. And our bottom line is to actually be very hopeful throughout this whole process.
So we'd like to thank you for participating in this webinar. I'd also like to thank, and we'd like to thank, both would like to thank Ann Gilbert she's a CanDo staff member and a wonderful person with whom to work, and she has organized the webinar. She was the person who greeted you at first. She is lovely and very encouraging to us out in the field. So we're grateful to Ann, to the rest of the CanDo staff, and to all of you for participating. We've also pleased to see that there are a number of questions on the chat portion, and I think that Ann will be able to kind of focus on those questions and pose them to us. I think you'll all be able to hear them.
Great. Well, thank you, Lynn and David, and likewise, just so excited that you guys were able to join us tonight and give us all of these great tips on how to help manage our healthcare team and how to communicate better with our healthcare members. So thanks for being with us. We did get some good questions. Here's one that was asked, and this person says that she sometimes finds it difficult to put my feelings into words that explain how I'm feeling or the difficulties that I'm having. How can I find the right way to describe what I need to explain these things? Sometimes I just feel like I walk out of an appointment feeling like I couldn't get my ideas across.
So I would think that verbally for this person that's asking this question is that maybe that's not the best way to communicate, but to write it down, to put into a different way of communicating, maybe, and also setting up another appointment so that if you walk out of a visit and you feel like things weren't really communicated, to go back, filter that information, write it down. There's, in some healthcare situations, you can either go through like an email process or through a portal through the particular organization, but to send that back to the person, because everything can't be processed at that moment, and we all process things differently. So I think whatever form of communication is important for you, to write it, to say it, to have another appointment, that's what the person needs to do.
Great,
Yeah,
thanks.
I agree.
Excellent. We have another question, and this is in regards to the various disciplines of your healthcare team. And this person asks, should we as the patient push for a referral if we feel it would be helpful for us to see a different discipline, or should we rely on a physician or our PCP to make that decision as to when that is necessary?
I would say if it's your life, you're the captain of your own team, and if you think that seeing another discipline would be helpful to you, you should definitely ask for a referral and make sure that your healthcare insurance requires a referral, because they may not even be required. You know, healthcare providers have a lot to think about during a visit, and I think if you do say, you know, I've been thinking about going to do this, or I'd like to try physical therapy, they're probably likely going to say, gee, that's a good idea. Let's make sure that we make that happen. I would not be shy about talking about it, and I would go forth and do what you feel would be helpful to you.
Absolutely.
Great.
I think we need to trust each other, trust ourselves more as patients, trust our own ideas. And we often invest so much in healthcare providers that we start to doubt our own ideas. And follow your gut on this. It's probably right.
Right. And David, this might be a good question for you. You had briefly mentioned earlier about, how some patients have a hard time bringing up embarrassing, symptoms that they're experiencing or embarrassing topics. Someone asked, how would they overcome the embarrassment on that certain issue to actually bring it forth to their healthcare provider?
Oh, God, that is a really good question.
Lynn, I think that, first of all, in a good healthcare team, a provider should be asking general questions, such as, how's bladder, bowel, sexual function? That should be an automatic question that happens. If it doesn't, there's always somebody, let's say the clinical nurse, let's say, or somebody in the system that you might be able to ask that if you don't feel comfortable with your provider, or to say to your provider, you know what, I have some questions that I don't feel comfortable talking to you about. Is there somebody in your practice that can help me out?
I realize that we omitted something that I think is important, which is, in working with healthcare providers, is to find out what is your healthcare provider's preferred mode of communication outside of the visit. So we heard from Lynn that she would rather her patients call her if there's a question about a visit rather than asking for a note. Now, some providers will take email, others don't. Some will read a fax from you, others won't. Some will listen to a phone message. And I'd say if it's hard to communicate during the visit, I'd say write it down and hand the piece of paper over, and have it folded, or say read after visit, whatever feels like it works for you, or else let your provider know beforehand. Dear Lynn Stazzone, I'd like to talk to you about sexual problems, but it's really hard for me to bring it up. Can you ask me during our next visit? The U.S. mail is still functioning for this purpose, I would like to point out.
Right. So an example is at our center we have young fellows who come and practice, and they are young, and oftentimes women, and sometimes men don't want to talk about sexual function, and they might pull me aside in the hallway and say, I didn't feel comfortable talking to the person I just saw. But I think there is a way to do it, and I think there is always somebody there that you can ask the question, and you can work around the system. It's just, you just don't maybe know that.
Okay. Well, I think that's a good segue to this next question that we received then. Is it appropriate, or does the doctor mind if I emailed them questions before my meeting with all the things that I want addressed, at the appointment?
Well, that's a real tough one, Ann. I mean, I think, first of all, for myself, there are some, in our system, we're really technically not supposed to use email. We have a system through the Brigham that we use called Gateway, but you only have X amount of time during your day to do stuff, so it might be hard to get that information ahead of time, but other providers might say that's the most ideal way to do it, and I think that's where the communication is important, to have that relationship with the provider to say, what is our best way to communicate? Do you want me to email? Do you want me to call? Do you want me to just to save my questions from when I'm there? Should I bring a list? Even though you should, but the best way is to ask what is the best way to do it.
Great. Good questions. Okay, so we have another question. And this person asks, what if your neurologist is just not listening to you? I went with some new symptoms. I went to my appointment with some new symptoms that I've been having, and he said to me, you're looking really good, and I'll see you in 6 months.
Okay, if I take this?
Yeah.
Let's just substitute husbands for that. And I would say if you feel like your husband isn't listening to you, the first act you should take would probably not be a divorce, but it might be saying to your husband, I think that our communication is not going very well. I hope you would give your husband a choice, or wife, or partner, or lover, the possibility of making the relationship better in that way. And communication, as we pointed out, is so important, so essential. So I would think the first step is to say, whether it be in your next visit or with a letter or an email or whatever way of communication, our last visit didn't really go that well for me because I didn't think you listened to me. And then you could say, do you think you can make this better, or do I have to go elsewhere? I mean, I hope you wouldn't have to. Mm-hmm. But think about it as there are a few steps before you switch providers, and the first step is to let your provider know that you're not happy. Right. Most providers do not would hear it, but don't want their patients to be dissatisfied.
Right, and providers are humans. They might be having a bad day or whatever's going on, and maybe they don't know what they're doing wrong or doing right. So you have to provide that feedback. Just as much as you might say it's not a good relationship, you can also tell them, wow, this is really working well as well.
Yeah. Now let me just say that some people are not good listeners, and you may have, if you've tried and your provider still can't listen, then it may be time. You could ask your provider and say, I'm looking for someone more who's a better listener. Is there someone you can recommend? Or turn to the community for recommendation. This is an important relationship. It has to really work well, and sometimes people make changes. You don't always have to announce that you're making a change. You can go and interview someone or make an appointment, or sometimes you might hear that another neurologist is giving a talk or a webinar for CanDo, and it gives you a chance to get a sense of who they are as a person.
Great. I think we have time for just a couple more questions. One here is, who should serve as a central healthcare professional for those newly diagnosed? Should it be my PCP, my primary care provider, or should it be my MS specialist or neurologist?
Well, that's really tough, because I honestly think that the central person in all this should be the primary care doctor, because you are more than your MS. But newly diagnosed, that is so crucial that probably all issues should go to the MS specialist, because at that point you're trying to figure out what is and what isn't related to MS. So it's probably better to start there first, and that MS specialist could say, no way, this is not MS. We need to contact your primary care, or we need to contact your endocrinologist or some other discipline as part of the healthcare team. But I think in newly diagnosed, probably the MS specialist should be the go-to person at first.
If I could add to that, there is a standard of care in MS, and MS specialists are much more aware of that than primary care physicians are. So sometimes someone who doesn't specialize in MS might say to a patient, well, you're doing well, so I don't think you need to go on disease-modifying treatment, without realizing that a person can be doing well clinically, but their disease activity can be going on in the background. Sometimes it could be spotted on an MRI, and that it's important to treat because we want to prevent any kind of further inflammation in the central nervous system. If someone's not an MS specialist, they may not be aware of that. And so I agree with Lynn that your MS care you should have an MS specialist, but you are a whole person with a whole body and a whole mind, and you still need a very good primary care physician, and hopefully the two will work well together.
Okay. One final question, and it's kind of a two-part question from someone. They say, which is more preferable, to select a healthcare team from private practitioners or from medical universities? And then they asked that they do live in a rural area and they don't have benefits of a full-time doctor. They have satellite clinics. So they're presently seeing a doctor who lives 2 hours away, and how can they coordinate their care between the MS doctor and their general practitioner?
Well, the first part, I don't really understand the question.
The exact question is, what is the best way for me to communicate, which is more preferable, to select a healthcare team from private practitioners or to select a healthcare team from a medical university?
So let me just start by saying that we're in a big medical facility, and we see patients some of whom live very, very far away. Some of them live in what they call down east Maine, which are many hours away. Some people live in other countries, and they come to our center for treatment, but their primary health care provider here will say, well, we want you to have a local person as well in case there's something that comes up between our visits. So, or if you need steroids or something else. So it becomes a kind of team effort with a local person and then the consultant who is an MS specialist, and they usually work together, and that's actually very common. So I would go with that model. Is you may see the MS specialist less frequently, but if there's something that comes up in between appointments with the specialist, you go to your local person who may ask the specialist, well, what do you think we should do for this? Lynn,
right.
Is that?
No, I think that's very accurate.
Yeah.
Okay, great. Well, I think that's all the time that we have for questions as we're getting close to our end time for the webinar. So again, I apologize if we weren't able to address everyone's questions, but we do have what's called Ask the CanDo team. You'll see here on our screen some more resources that we provide to anyone who visits our website. It's called Ask the CanDo team, and you can find it on www.mscando.org. You can submit whatever question that you might have, and you can also submit any question that you wanted answered on this webinar, and we can forward it to either David or Lynn or one of our other many program consultants, and we'll have the question answered for you. And sometimes we might even post the question and answer on our website. So feel free to check out our website to submit those questions or to even look at previously asked questions and answers that you might also have questions about yourself. We also have what's called e-news. It's a monthly email that we send out to all of our programs participants, and they're also all posted on our website. And it's just a fun little newsletter that includes all of our program information, all of our events that are coming up, and just some fun facts about CanDo. So please remember to check your inbox, your email box for those monthly emails. And we also have a library. It's called our CanDo Library, and it's full of articles written by our 60-plus consultants. And David and Lynn also have an article written in the library. So please, visit our website, and there's all kinds of fun resources that you can find. So our next webinar will be on the second Tuesday of November, on November 11th. It's at the same time, 8 o'clock p.m. to 9:15, and it's all about communication. We'll talk about how you can communicate with your friends, your support partners, your loved ones. And on the webinar will be our occupational therapist, Beth Bullard, and our psychologist, Roz Kalb. So please remember to register for this webinar as well and join us at your home or office. And for those of you that are participating tonight, once this webinar is over, you'll see a survey pop up on your computer screen. We'd love it if you could just take a few minutes to complete the survey and share your input. Your feedback really helps us to improve our webinars and gives us ideas for new topics for the next year. And again, as I mentioned, you'll receive a copy of tonight's webinar slides and information of how you can view the webinar tomorrow. So thanks everyone for joining us, and a special thanks to David and Lynn for taking time out of their Tuesday evening and for helping us this evening on how to talk with our healthcare professionals. So thanks everyone, and have a great night.
Thank you.
Thank you. Good night.